You've made the decision to have your cataract fixed because you want to see better. Let's talk about what really happens on the day of your surgery, from the moment you arrive until you're headed home seeing better. Most folks get a little tense and nervous when you start talking about eye surgery. They tend to all ask the same common questions. Will I be awake? Do I need a driver? Will I wear a patch on my way home? Since you'll be getting anesthesia, you'll need clearance from either your primary care or another provider, and in many cases you'll need an EKG. A strict policy of nothing after midnight is important. You'll have to arrive on an empty stomach. Just a cough drop or a cup of coffee can cause your surgery to be delayed or even canceled. GLP-1 diabetic medicines like Ozempic must be held for a week also. Start your eye drops 3 days ahead as you're directed in the office, and also we'll ask you to clean the edge of your lids off the night before surgery. Plan on spending about 2 or 3 hours at the facility by the time you get in the door and walk out the door. Once you're admitted, you'll put on a gown, a nurse will start your IV, and a nurse will also give you your dilating drops and antibiotic drops. Do not wear makeup to the surgery center, as it will be removed before we operate. It has to be off in order to keep the space sterile. I also recommend leaving your watches and jewelry at home so they don't get lost. You'll meet your anesthesia team, and I'll mark above your eye, confirming the side that we're working on that day. You'll be given a medicine called midazolam through an IV. It's also known as Versed. It works right away, and you will feel very relaxed. You'll also get numbing drops so you don't feel anything. During the surgery, you'll be very relaxed. Honestly, sometimes a patient falls asleep and sometimes they talk to me. But if they're talking to me, it's usually about something that has nothing to do with eye surgery and they don't remember afterwards. You won't see instruments or feel pain, just some gentle pressure and some cool water perhaps, and surgery takes typically less than 10 minutes. Most patients leave 15 to 20 minutes after surgery. Your nurse will go over your post-op instructions and you'll leave with some sunglasses or a clear shield over your eye. You'll also need a driver to bring you home, as you can't drive after anesthesia as it's dangerous. You'll probably see much better the next morning. Sometimes it can be a little foggy if you have some swelling and may take an extra day or two to clear. And it's also not unusual to have a red eye the next morning. Follow-up in the office by the next day is critical. We have to check your wound and your pressure and make sure everything's okay. Most people can't believe surgery happened when we're done. They often will say, "Did you start already?" And they don't remember the case itself. They will often the next morning ask me, "Can you hurry up and do my other eye? Because the one I worked on is already seeing better than the one that they haven't had done yet." You will not have both eyes done on the same day. There's no rule for when we do your second eye. That cataract must also be significant visually and can usually be done within a few weeks if it's needed. In the next video, we'll talk about lens implant options. That's the part that makes your vision better than it was before.